Hello, my dear students. I'm Dr. Vaishaly Bharambe, Professor Anatomy. Jugular foramen. Okay, so obviously, as the name suggests, it's likely to be something related to the internal jugular vein. Okay, so zoom in on that area. Understand, I've just turned the skull. Okay, so you were watching it like this, now you're watching it like this. Okay, so the occipital region is right here on the top, and this is the broad bar of bone. Okay, you're looking at the skull from anterior to posterior, like this. Okay, I hope you got that. Okay, so here is your jugular foramen, posteriorly formed by the occipital bone, anteriorly formed by the petrous part of temporal bone. This little gap here is your jugular foramen. It's quite a large gap. I'm calling it little, but it's quite a large gap. So large is it that it's divided into three parts: anterior, intermediate, posterior. Through the anterior part passes your inferior petrosal sinus, going down to drain into the interjugular vein. Through the intermediate part pass the three cranial nerves, 9th, 10th, 11th. Why not 12th? Of course, why not? Because it has its own canal. So it doesn't need to pass through the jugular. It has a hypoglossal canal. Right. And also passing through this is the meningeal branch of ascending pharyngeal artery. What is left then for the posterior part? Of course, the internal jugular vein, which is the downward continuation of the sigmoid sinus. Again, the third most commonly asked question. Foramen ovale, most common, foramen magnum next, and jugular foramen, another very commonly asked. Jugular foramen, again you have a lot to talk. It's divided into anterior, intermediate, posterior. Through the anterior passes your inferior petrosal sinus. Through the intermediate pass your 9th, 10th, 11th cranial nerves along with the meningeal branch of ascending pharyngeal artery. Through the posterior part passes your internal jugular vein as a continuation of sigmoid sinus. So, what is jugular fossa? If you look carefully, there is a little fossa there. Even your little finger can enter into the fossa. It's clearly visualized little space into which lies your superior bulb of internal jugular vein. If you're enjoying this lecture, students, do please like, share and subscribe to my channel and hit that bell icon. Do visit my website www.vpanatomy.com. That's where you will find more of such detailed lectures, a lot of surgical anatomy lectures, MCQs, and downloadable notes. So I love taking this lecture. I hope you enjoyed it too. Thank you.